Okay, I'm here with the great Brian Stepnenko. He's a physician and he also has a master's degree in public health. And we first met years ago, but we'll get into that later. Tell us about your background. Tell us how you went from conventional medicine into functional medicine, and now you're really having a huge impact carrying functional medicine into military medical management and care and getting that model into that. But before we get into all of that and talk about some of the things that you see with soldiers having to deal with, like traumatic brain injuries and PTSD, give us your background. How did it all start for you? How did you decide to be a doctor, and how did you transition to functional medicine? And let's just start with that, and then we'll talk about all the great things you're doing.
Certainly. So prior to coming into medicine, I was a firefighter paramedic down in South Florida. Um, Very much excited and interested about um, helping patients through the struggle. Acute care medicine is definitely where I jumped into patient care from, but being in the fire service, putting emphasis on being fit, being ready to provide care, whatever the circumstances, whatever the call, was always in my background. And me personally, I'm a cancer survivor, so I had leukemia when I was three years old, and I was in remission by 5 years old. So my parents always had that background of and then understanding that food is medicine and take care of yourself, focus on sleep, focus on the basics. And they were always after me to really instill some good, healthy behavior habits. Then being in the fire service, I had a drive to know more, do more, and want to be part of definitive care. Shadowed a few docs and realized medicine is something that I can do. And I went from thinking about emergency medicine, but very quickly realized that I didn't want to do all acute care when people are the most broken. I wanted to be part of the opportunity to see people both in their well states, or at what they perceive to be well, and also when they're sick, ill, or injured. And family medicine really resonated with me in medical school. But I got so lucky that at the University of Miami, where I went to medical school, they had a partnership with the Institute for Functional Medicine. And in my first month of medical training, my mentor, who was part of the Exercises Medicine worldwide effort and initiative, he said, "Hey, you're into this lifestyle medicine stuff. You should go check out this guy, Mark Hyman. He's talking over lunch. Like, go check him out." And I did, and really opened up my eyes to the world of opportunity that led to me training two brains throughout medical school. Every other Saturday, come hell or high water, I was showing up to this extracurricular training program that was not adding to my ability to pass the test at the end of medical school, but was 100% building my idea of what's possible, and creating such an optimistic view of me, of the type of medicine that I want to deliver, regardless of where I end up. And I accepted military scholarship to go to medical school, so I knew what community I was going to be part of. And for me, it was just joining a bigger fire department. It was nothing but opportunities rather than obligations. So when I got through medical school, I had this fantastic awareness of what functional medicine can do, and was so motivated to bring that to the military community. And I've been lucky and just blessed to be able to do that. But knowing what we know, learning what we've learned, you can't unlearn it. You begin to think differently. So I was learning about some of these primary areas of concern and the highest priorities for the military community. And the people that are learning through this program are going to approach these problems very differently, and in a more proactive, personalized, participatory manner. And it's an empowering message that we can have with the patients when you talk to them about how you can optimize your immune system, you can optimize your metabolic and hormonal functioning, and how you can protect your brain, and you don't have to wait till the time of injury to do something about it. So I linked up with my muse, my friend, my mentor, Jeff Dardia, who's a Green Beret, a Special Forces Green Beret. He's done it throughout his full career. And he was a person who broke and was getting conventional care and was not accepting the answers that he was getting from conventional care, and fixed himself by pursuing functional medicine through the Institute, Cleveland Clinic's Center for Functional Medicine. And I was doing a rotation up there because I wanted to. I organized it, and they connected me with this guy, Jeff Dardia. And we've been on the road and supporting each other's efforts ever since. And we jokingly say that we are super nodes of the military functional medicine community. And we're always putting people in touch with other people, maintaining situational awareness of who's doing what in what area, what lines of effort. But warfighter brain health has really been a guide on for the highest area of priority and opportunity. The biggest attention, the biggest resources is all focused around warfighter brain health right now.
Okay. Now, when I first met you, you were at the University of Miami, but you figured out some way to transfer into the Loma Linda functional medicine elective, and it was like a 2-week elective. And I get a call from Dr. Ionel Hubbard, who is the director of the program there, and she was like, "Hey, there's this guy. His name is Brian. He's a serious guy. You need to pay attention to him." I'm like, "Really?" First of all, she's never called me about that. Anyone there? Okay. So then I met you. I'm like, okay, yeah, this guy's dynamic. This guy's gonna make some huge changes in the world. And then I'm like, all right, nice to meet you. Good luck in your career. And then like fast forward a few years later, you're speaking at the Institute of Functional Medicine conference. You're talking about traumatic brain injury, and I'm like, damn, Brian, quickly learn all the principles and was up there. And I'm like, hey, this guy's a superstar. So your dedication is really being noticed, and you're really making an impact on everyone, and that's pretty amazing. What were the things that were like exciting to you? Just the fact you can support function, was that the key thing that light came on, that switch came on? Or
I mean, the messages that resonated with me from the outset was exercise is medicine, food is medicine. The empowering message of what you do, think, and eat matters. Right. And the fact that I can change the conversation in the clinic to where I never have to say it's all in your head or I've got nothing for you. Those are the worst things that could ever come out of my mouth as a practitioner or a physician. And I sometimes wonder what my colleagues that have conventional training only, that don't know these things, what do you do when you hit that wall? I don't hit a wall, because there's always something we can do. And there's always an empowering message of here's how, what you do, think, or eat is tied to the symptoms that you care about. So that light bulb goes off more often. We have some more of those aha moments, and some more of those opportunities to, hey, here's the first step. And let me show you that doing this will make a difference. And when we start seeing some of those patient outcomes, the reminders of why we joined medicine, I see those more often. Sometimes I think that than the peers around me, because we're addressing root cause dysfunction. We're helping them unravel their ball of yarn. And just knowing that that's possible, and me, the way I approach things is that I establish systems and processes for it and rally others around who are, mission aligned or like-minded. We've been able to generate so much interest and motivation to roll this out that it's truly become a military functional medicine community. And that's the empowering thing. That's the hopeful thing. That's why my life mission and purpose is focused on bringing this and expanding this within the military community.
So Ryan, are you just practicing primarily as a military physician, or do you have a private practice too?
Army family physician solely. And by the way, I do need a obvious disclaimer. And if this can go towards the beginning of the interview, that'd be great. The views and opinions that I express are my own and do not represent that of the DoD, the VA, military health system, or any other organization or entity. Thank you.
Oh, of course. And working with your everything is based on your personal views and your experience, and keeping with that mindset. You're working with. When I heard your presentation, I found was on traumatic brain injury, and then I know you're working with traumatic brain injury, PTSD, and suicide's high in that population. Is that the primary areas you're focusing in delivering functional medicine in your patient population, or what's the story?
So healing invisible wounds is I think something that resonates with a lot of motivated groups, and there's pockets of motivated individuals that rally around lifestyle medicine, integrative medicine, hyperbaric medicine, and even functional medicine. But the things that we can all rally around is that there are invisible wounds, and wounds from the total allostatic load of exposures in the military operational environment. And being able to agree and nod, yes, that's right, to the exposures, and being able to identify those exposures and how it impacts physiology, being able to speak that language is able to align all those different groups of professionals. So I'm not sure if I directly answered your question of, is traumatic brain injury and functional medicine exactly my lane? My lane is, call it what you want, optimizing brain function, healing invisible wounds, and broken brains is one of them.
Okay.
Yeah.
So do you see a relationship between traumatic brain injury and suicide? And do you see a relationship between traumatic brain injury and depression and PTSD? And do you mean in the timeline you see everything's fine and then you see injury, but also are you seeing injury years and years later? Are you able to see that? I mean, as a
Yes.
clinician myself, I see different types of brain injuries then showing their window and expression years later. Are you working with a patient population where you see the expression of brain injury years later, or are you seeing in the acute phase? What are you mostly seeing in your practice?
Right. So we get people near the end of the career that finally raise their hand and pursue comprehensive evaluation that didn't raise their hand earlier throughout their career, despite multiple exposures, despite multiple mild TBI injuries, despite multiple concussions that never got medically evaluated, because there are disincentives to raising your hand and fears about losing your ability to support your team throughout the career. So we see people close to time of injury if it's moderate to severe, if they're obviously impaired and unable to support the fight. But we see later in the career and sequelae from mild TBIs much later than the point of injury. I'm talking about years later, after their sleep has been disrupted for a long time, to where they've developed obesity and probably some hormonal and metabolic dysfunction, possibly from pituitary gland dysfunction. That pituitary gland gets rattled between the Turkish, oh boy, that term. And we see brainstem injuries that could be impacting their ability to breathe throughout sleeping. We see endocrine dysfunction from pituitary gland dysfunction. It's called neuroendocrine dysfunction, and that's subsequent to TBI, moderate or otherwise. And we also see blast overpressure exposures that are leading to a totally different mechanism in pathophysiology. So it's not chronic traumatic encephalopathy. It is astroglial interface shearing, AIS. And we're seeing mood disorders. We're seeing lack of ability to control impulsive activities and anger. We're seeing sleep disruption. We're seeing suicidal ideation, and then substance use disorders to basically try to self-treat. And sadly, sometimes these result in the D's, the divorce, the drug use, the DUIs, right. The discharge from active duty service. And it may not be their fault. It may be that they haven't been evaluated. They haven't identified that this is actually an issue, that, hey, you're not sleeping, you're not producing hormones adequately, your brain's not functioning the way it used to. Yeah. And haven't heard that optimistic message that you can do something about it yet.
Yeah. It's interesting because for me in my practice, I work with functional medicine cases. I don't have a neurology practice. And, I basically I do a complete physical examination, which involves a neurological exam. And, it turns out a lot of these chronic patients that have chronic gut issues or chronic endocrine issues or chronic mood disorders and everything, they actually have a brain injury that's caught up with them years later. And then you go wonder and think, why am I seeing it? And the reason I'm seeing this is because I'm just doing a thorough exam. And functional medicine is notorious for not doing a physical examination. So how are you going to distinguish neurological symptoms that are brain injury from a let's say, chemical imbalance or a hormonal imbalance, right? So when you see upper motor neuron signs, you see abnormal muscle tone, you see changes in ambulation, you see, you know, abnormal conjugate eye movements, you see nystagmus, you see all these things. You're going like, your brain is injured. Has anyone ever diagnosed this for you? And it's like, no. What do you mean? I thought I had this weird, strange endocrine disorder no one can figure out, or had this weird, strange. I thought I was just the anomaly. And it's like you look back on the timeline, and you see that injury, you see all these effects, and that's part of the frustration I have too, and it leads to those things. And so you're seeing that. You're seeing the endocrine disorders. You're seeing chronic gut issues, I would assume, right? Dysautonomia patterns.
Especially related to deployment. With deployment, there is a much lower threshold for antibiotic exposure, particularly antimalarials, doxycycline. People will be on for 6 to 12 months at a time. Okay. And then things that are endemic to that area, or eating the local food, drinking the local water, bathing in local water, they'll come home with parasites. So gut dysfunction following deployment is a very common thing, especially in the military community. That's one. Two, airborne hazards and occupational hazards, industrial chemical exposures, munitions from the weapons that they get high amounts of exposure to through training pathways, not even deployment environment. Now it's training pathways. The blast exposures they get through training pathways, as well as downrange in deployment settings. So it's injury, but it's not mechanical injury all the time. We really have to factor in the dysbiosis, the occupational, chemical or heavy metal exposures, the airborne hazards, and the inflammatory exposures that they might have had from burn pits or otherwise. We're learning a lot about these total exposures that are creating the invisible wounds.
Yeah, one of my dearest friends that I grew up with was in the Navy, and he was in the demolition team. I'm not sure what the proper military word is for it, but he told me he came when he was like 30, and it was, young in practice, and he's like, "Hey, I can't taste anymore." I'm like, "What?" He goes, "I can't taste food anymore. I can't smell anymore. I can't taste. I'm having some neurological symptoms." And I'm always, "Well, tell me what your career was like." He's like, "Well, I used to swim in chemicals all the time during my duties."
That's the truth.
And I was like, okay. And he ended up with leukemia. He ended up having renal failure. He's actually passed away just last year. And Jesus. And it was this timeline, and I'm like, oh my God. And I've seen close friends that have also had some traumatic brain injuries that served in the military, and I've seen some of their effects. Really close friend of mine is complete personality change after those things. And it's not, and you make a good point. It doesn't always have to be trauma to the brain. It could be these other metabolic vascular insults. But sometimes those, you okay? You good?
Yep. All good. Somebody was at my door. Apologies. Can I hit the pause button real quick? I need to plug my phone in. Yeah. It is about to die. I apologize.
So Brian, as you know, when people get injury to the brain, whether it's chemical, metabolic, traumatic, the glial cells get upregulated, they get active, they become overzealous, they get primed, and they have any subtle inflammatory responses then trigger their symptoms. And wherever the injury is in the brain is where they typically have more symptoms. If it's frontal lobe, they get focus, attention, concentration issues, or unable to gate their limbic system, and maybe start to have PTSD expressions or anxiety, or whatever those mechanisms and those pathways that are injured. So what types of strategies are you working with when you see people that have injury, whether it's metabolic, chemical, or maybe it's a combination of both? Maybe that a little bit of a trauma before, now they get exposed to some inflammatory trigger, and now everything is much, much worse, and an unproportional response because of that pre-existing injury. Share us with your insight with the soldiers.
I've after seeing a few patients and knowing some of the functional medicine core concepts, starting with the gut, anti-inflammatory diets, remove some of the triggers, and then creating a healing environment for the brain and the person more generally. Put together a handout and looped in a couple of communication tools, because I was trying to do this within about 15 to 20 minute appointments, or at least a series of them. Essentially, my baseline go-to starting points are asking them about sleep and having them track sleep. So getting something that tracks accelerometry and HRV, some wearable tech, and sharing some of those numbers and reports with the touch points that I have with them. Then anti-inflammatory diet, especially with some time now supplements, prioritizing high dose fish oil regimen that I'll mention in a minute. It's called the omega-3 protocol, and I'll bring you back to that. But there's a military researcher that did a lot about how fish oils can help create that healing environment to promote neuroregeneration, creating a neuropermissive environment, he calls it. But then, like from your training, curcumin, resveratrol, looking at vitamin mineral sufficiency, addressing vitamin D, magnesium deficiencies, which are very common, and making sure they're getting adequate fruits and vegetables, water intake, some of the basic stuff there. So pretty standard dietary approaches, some nutraceuticals and herbals to create that neuropermissive and brain healing environment, evaluating and quantifying their sleep quantity and quality. And then I've learned to plug them into some organizations, some nonprofits that have functional medicine minded individuals at the helm, like Warrior Angels Foundation. That's an example of one of them. Task Force Dagger Foundation, another one of them that I point individuals to. And there's a couple of others that are incorporating lifestyle medicine, integrated medicine modalities like transcranial magnetic stimulation, neurofeedback, and they'll evaluate them with SPECT scans or functional MRIs. They will do QEEGs or evoke QEEGs. They'll do some eye movement tracking assessments to create a baseline and also evaluate at interval. Hyperbaric medicine has been another, I'd say, foundational metabolic therapeutic option that has been helpful for a lot of individuals. And I've started to layer that into the practice once they get some of these foundational practices in place and creating that neuropermissive environment. This adds to that stem cell production, the anti-inflammatory activity, and basically the opportunity for the brain to heal just a bit faster. Scott Sherwood has presented to a virtual learning collaborative about hyperbaric medicine and its application for helping heal invisible wounds, helping heal brain injuries. So it's just a question of when would that be the right time for this individual. So for an acute head injury that I'm seeing them close to point of injury, it could be a much shorter regimen of treatments, something as short as 5 dives, they call it, for hyperbaric medicine. But if I'm seeing them years after the point of injury with that neuroendocrine dysfunction pattern in front of me, then they may need 40 treatments and maybe even another round or two somewhere along the way. So yeah, a lot of tools in the toolbox, but really the dietary focus, the anti-inflammatory focus, the fixing the gut, and making sure the sleeping patterns and dietary habits are supporting optimal brain healing, and then trying to help the brain heal a bit faster. Transcranial magnetic stimulation, neurofeedback, hyperbaric medicine, and there's definitely a couple other options. Another one is stellate ganglion blockade for like PTSD treatments, layering that in, trying to get patients access to that. They've all found these modalities helpful, but they're all tools in the toolbox. It just depends on what the patient's ready for, where they're at, what they have access to.
Wow, that sounds like a pretty thorough protocol you're engaged in. That's amazing. And good. It's good to see that soldiers have access to that kind of thorough protocol.
And the other thing is that it truly is a community of people that can help. And a lot of these nonprofits that I mentioned, just examples being the Warrior Angels Foundation and Task Force Dagger Foundation, which I have no direct ties to, full disclaimer, they can do the things that I don't have time or have organizational constraints around. So they can help the patients in ways that I've kind of vetted of how they work with individuals. And I've already identified that, hey, there's functional medicine trained individuals at the helm here, and they're prior military. They get it, and they get the patient. So they can help this patient. I just got to put them in front of them. And I got to get some starting points before I get them in front of them. So I don't have to do all the lift myself. I just got to be able to get them to people who can help them in the way that I know is possible.
Right. So tell me more about, you use the word neuroendocrine immune dysfunction after TBI.
Yeah.
So, I think there's a lot of people that are in functional medicine, and they're so focused on, is it gut, is it adrenals, is it hormone balance, and they haven't really connected with the fact that when the brain is injured, there's complete dysfunction to these other systems. So
Yeah.
if a person doesn't have that connection, kind of share with us what you can see from your expert opinion of being around so much of that. What's happening with males, hormones, females, what's happening with their mood, what's happening with their gut function, what's happening with other clinical symptoms you may not attribute to the brain, but you're seeing as part of the neuroendocrine immune disorder.
No problem. And there's a couple of articles I'll try and put in front of you afterwards that look at pituitary gland evaluations via stim tests or just via panels to look at the neuroendocrine dysfunction that follows. And it's not all traumatic brain injury, but there is a portion of those that have traumatic brain injury exposure and concussion history that manifest with neuroendocrine dysfunction. Essentially, it's pituitary gland injury, either in the form of the vessels that supply the area have been injured from the coup counter coup and just the way the pituitary gland sits within the cell Tertiaria.
Yeah.
Tertiaria. Thank you. And the other area of injury that we see is the brainstem, the stalk, the respiratory control centers, and that coup counter coup. There is a point of tether, essentially, that gets injured, and sleep apnea rates are much higher in this population, especially with the chronic exposures, the subclinical or undiagnosed concussions and mild traumatic brain injuries. So both of those areas we see injury in. Now, specifically with the neuroendocrine dysfunction, there are research groups and best practices for how to screen for it. There's panels that you could readily Google search and find TBI, neuroendocrine dysfunction panel, and you'll find VA DOD guidelines that
Really?
say, hey,
Wow.
It happens. We know it happens. Here's the panel to evaluate for it. And the 3 months to 3 year post-injury window. That's at least what they'll recommend to look for it. But there's another paper that came out.
Brian, let me stop you really quickly there. Are those testing like pituitary stimulation testing? Like, is that what they're doing?
Yeah. Stand by 1 second. Yeah, so there's pituitary stim test specifically for this one paper that I'll put in front of you. It was the basically a pituitary clinic. I've never heard of a pituitary clinic, but there's a pituitary clinic in the military health system that was based out of I'm sorry, I'm getting another phone call. Based out of one military treatment facility, and they've evaluated with stim panels, stim tests, the full kind of pituitary function assessment. And that was a really interesting paper. I actually saw that one this morning. So with regards to that, if we're seeing some guys with the thyroid dysfunction, and that's the melancholy, the depression, plus or minus on whether they have that major depressive diagnosis. We see substance use and people kind of self-medicating for some of the either doc, I got low T feelings that they'll report, sleep dysfunction, sleep issues, decreased ability to focus, think, make decisions, or remember things the way that they used to. Their performance may start to suffer. They'll feel task saturated and overwhelmed much easier compared to their younger days when they knew that they could handle anything their unit throw at them. There's discord and dysfunction within the family. Relationships tend to get strained when individuals come home and they either start drinking, or they have short triggers and they have anger outbursts, or they just haven't been sleeping. Everybody knows when you're sleep deprived, your threshold for being able to get through, an argument or do things right is definitely impaired. Did I generally touch on?
What about immune function or dysautonomias, heart rate variability? What kind of things are you seeing with that?
Actually, I'm seeing several interesting dysautonomia. Now that you mention it, a couple of like Jeff Daugherty, the gentleman that I told you that's my friend, mentor, muse. He's been. Yeah, it's probably HIPAA. I'm probably giving you too much info, but bottom line, dysautonomia is definitely something that we're seeing, not in high numbers, but enough to where the ability to assess the dysautonomia is definitely a challenge within our community because of the totality of exposures. And I don't know if there is a different functional medicine approach to dysautonomia compared to conventional approach, but that is definitely an area of opportunity. What was the other item that you had mentioned?
Immune function.
Right. With regards to immune function, I mean, we've got, I almost don't know what to compare it to because the population is who I treat and what I've been immersed in. But we definitely know that being active duty service, 60 to 70% of our population is vitamin D deficient because we show up at 0 dark 30 and we maintain fully covered head to toe throughout the workday, and we go home or get some sunlight on our skin at less than optimal hours for UV exposure. So vitamin D deficiency across the board, omega-3 to omega-6 ratio index is off on our population. And that's some of the work of that military researcher that I mentioned to you. So Mike Lewis is his name. He's a functional medicine trained individual with Warrior Angel Foundation as well. And then other vitamins and minerals that are pretty essential to optimal immune function, simple things like magnesium, we tend to see deficiencies as well. I mean, comparable to a standard population there.
Right, but it makes a huge impact on them when they're deficient in those issues because they're trying to heal from an injury. What about gut dysfunction, like motility issues, constipation issues, bloating, distension, inability to digest their food? How do you see that with TBI patients?
Right. Following the TBI injuries, I've definitely seen dysbiosis develop. Dysbiosis in the form of dysmotility, and that's setting the stage for things like SIBO, things like chronic constipation, things like systemic inflammatory symptoms that make me think about leaky gut or intestinal permeability. Definitely seen that downstream sequelae from head injury, but then the question becomes, how the hell do you treat it? And that's where the vagal exercises, the vagal tone exercises, I've added that sixth R to the gut healing protocols from the functional medicine trainings. I actually went back to the IFM and said, hey, you guys aren't talking about retone the vagal, the vagal pathways here. So truly what you taught me through the Apex Energetics training has trickled into what the military functional community understands as part of the total picture. Like, we need to retone these individuals, and that's exercising the muscle that you're trying to grow.
Right. So you just, thanks for classes. Okay. So, one of the things I think a lot of the population of people that are taking our educational programs or private practice, they're, seeing the average person, civilian, right? It's not a military population, but within that population, there are definitely people that have head injuries. And the biggest clue that if a patient's chronic and may have a head injury on it is, like, if you dig back and look for a timeline. But a lot of times the patient doesn't know that the car accident, the trauma they had, or the sports injury they had that made them dizzy for a while, is really having its expression and effect on the road. Now, some of the red flags for me are, like, if I see someone that's young, all of a sudden have disproportional neuroendocrine immune imbalances and dysfunctions and autonomias. And even if I don't even do an exam yet, I go, okay, well, this is a concern. Have you ever had a head injury? People that have dysmotility issues is a major one, because motility is brain function. Motility is the expression of muscles contracting. It's neurological contraction. It's not what you eat. It's not what you eat. It's like it's motility. So people that just have chronic constipation and can't digest their food and have to take like laxatives. And if I see like a 30-year-old person having to take magnesium at night to have bowel movements and their heart rate's crazy all over the place and they're having depression, I'm not thinking like there's a hormone imbalance specifically. I'm thinking what happened to the brain.
Right.
You see that history there. So from your experience now seeing these relationships with these neuroendocrine immune disorders and sharing that for a person who's just working with chronic patients, because people that have these neuroendocrine immune disorders, whether it's pituitary related or just dysautonomia for sharing autonomic centers in the brain, or various pathways involving different regions of the brain and its impact on the brainstem. But people that are now having these brain injuries and then showing their expression of the throat, what would be some tips you would give to the average functional medicine practitioner to like, hey, it's a heads up, this may be a brain injury. I mean, I could say one of the things you said that I've seen directly related to it is the inability to handle and dampen their impulses, which is like, especially with frontal lobe injuries, that's a big one. Motility issues is a big one. But if you were just to give advice to the functional medicine community as a whole that is dealing with chronic patients, because as you know, when people get a head injury, the basic question is, are you okay? Yeah, I'm okay. All right, let's get going. I'm a little dizzy. That'll be fine in the next 3 days, and then move on. But then the aftermath of these glial cells turning on and causing these problems down the road it takes time. So what would be some red flag suggestions you think would really help the functional medicine community pick up on some of these head injuries? And a lot of times patients don't put it in their history and their timeline or tell you about it because they don't make the connection.
Right. I mean, first thing is incorporated into a standard intake process. I think there's three main tools that we need to incorporate into our functional medicine intake, functional medicine workup, not just the two. It's not just the timeline of the matrix, it's the intake form. And the intake form definitely needs to incorporate something that probably asks in various ways about any type of concussive exposure, traumatic brain injury, or other types of injuries or exposures that could have led to brain injury, either chemically or via inflammatory pathways or whatnot. But asking those questions and doing the MSQ should cue you on to whether or not you need to think about it. And if they haven't brought it up, something like a very thorough intake process that incorporates questions that ask different ways about it, or some of those downstream sequelae from it, like the gut, in the MSQ, if their gut scores are high and their cognitive scores and, mental scores are high, then, all right, let's think about this. And then building that timeline, asking about those events, like, hey, I see mountain biking was, something you did as a kid. Did you ever take a big spill? Did you ever get your bell rung? Asking in various different ways will get you various different answers. Right. And queuing on, being a functional medicine detective, almost like Sherlock Holmes. When you hear certain key terms or key activities, ask more. Like I mentioned, at least with the military population, we have a lot of risk-taking behaviors early in life. So did they box previously? Did they do MMA, contact sports? Did they play team sports and high performers? Ask a variety of those questions around head injuries or exposures.
Right.
Dysfunctional families. Did you ever get into fights? Did you ever get, hit in the head? Did you ever get knocked unconscious? Get into a lot of fights growing up, that type of stuff. Really, the questions you ask will come from the intake that you do. The deep dive, even before they walk in the room, should provide you a lot of information to arm you with some questions. And being that functional medicine Sherlock Holmes, when you hear certain key activities or exposures, digging deep, especially those never the same since moments, like you said. So
yeah, those are good.
Deployments might be it. Vehicle rollovers or car accidents might be it. Dysfunctional families and growing up fighting or contact sports, extreme sports, that type of stuff.
Yeah. And I would also for sure add like have you actually lost consciousness? Because if you lose consciousness, I mean, you've had a significant enough an injury, or you lose the ability to activate your reticular activating system, and that's not going to happen with just a slight bounce of the head. It's pretty severe. And then once that loss of consciousness is there, they have that for sure some degree of glial priming because that's a severe injury. And then those things catch up. And then the other thing that I think is really important, I think for people to know about, adding to what you said, was just their symptoms come on when their brain's fatigued. So all of a sudden their bloating distension is much, much worse. If they had to like drive for a long period of time, their brain's really tired, or if they get enough sleep and their brain's really tired, there'll be that direct relationship between their brain fatigue and then some of their neuroendocrine immune related symptoms. Are you seeing that as well, Brian? Okay, I think we lost Brian. I don't think he's got the best connection with the military bases in, but just to finalize on a couple of key things that are really important. When people have traumatic brain injuries, years later, they'll have their clinical presentations. Some of the most important things to remember is that anytime you see a person that has lost consciousness, you suspect that they have some degree of glial priming. If they had multiple instances where they've lost consciousness, then you suspect that there could be some injuries there. Now, each patient can have their unique level of expressions or their different symptoms based on where their brain was injured. If you look at the brain region localization form, we can quickly identify there are symptoms there. If you see lots of 3 or 4 ratings between 75 and 100% of the time that the symptoms, that'd be a clue to you that their brain is really, really impaired. Impulse control is a really big issue, especially when the brain's really tired. People have frontal lobe injuries, which is a very common area for trauma to impact the brain. And then you'll also see motility issues, gut issues, dysautonomias, heart rate variabilities with some of these patients. And those are the things that I really wanted to emphasize with this interview. And just having a little bit of time to speak with Brian, where he's actually seen the systemic effects of traumatic brain injury, I thought was very helpful for all of us. And we'll end this interview with those thoughts in mind. Thank you.